Systemic lupus erythematosus. Systemic lupus erythematosus, or commonly known as lupus, is an autoimmune disease that affects thousands of people every day. Although a vast number of people are diagnosed with the disease each year, the general population knows little to nothing about the disease itself. The latter proves to be problematic for many lupus patients when trying to explain their conditions. Therefore, I am providing a brief overview of the disease, including what it is, who it affects, and how the disease itself is treated. According to author Daniel Wallison, entitled Lupus: The Essential Clinician Guide, published in the year 2014 by Oxford University, lupus is a multi-system pleomorphic disease in which inflammation, antibody production, and complement-fixing immune complex dispositions result in tissue damage. Essentially, lupus creates antibodies which then attack healthy cells within the human body. This makes lupus extremely hard to diagnose, as sometimes doctors will account for symptoms through a much simpler diagnosis such as bacterial infection. The common misdiagnosis of lupus is what makes the disease so dangerous. Left undiagnosed, lupus can ravage the body and attack important organs such as kidney or liver, resulting in a life-threatening situation for the patient. There are many symptoms of lupus, and every case is different. The most common symptom in a lupus patient includes photosensitivity, a butterfly rash which appears on the face, at times extremely fatigue, joint pains, and various infections throughout the body. Similar to other autoimmune diseases such as Crohn's disease, lupus has periods of activity known as flares, which can be described as times when the patient is experiencing severe symptoms and discomfort. Because lupus has so many different symptoms, treatment for lupus can sometimes be extremely challenging. Not only is it difficult to treat all the symptoms, the treatments itself can sometimes have unwanted side effects. The most common type of treatment for lupus patients is called NSAIDs, such as ibuprofen, steroids, and hydrochloroquine, an anti-malaria drug. Usually a combination of these treatments are used to combat symptoms of lupus. Author Tiago Marquez and Davy Oregano state in the journal Lupus Symptoms, Treatments and Potential Complications, published by Nova Science in 2012, that due to early diagnosis and better treatment options of both diseases and complications, the prognosis has markedly improved in the last decades. The 5 years survival of the patient with SLEs has exceeded 90% in most centers. However, morbidity, especially renal failure, from cardiovascular events to long-term follow-up is still an important issue. Final point. Who is affected by lupus? 2010 NIH Extramural Review, Andrew Kim, Photosensitivity containing lupus erythematosus. Photosensitivity covers not only skin disease flares but also systematic symptoms such as fatigue and arthritis. Thus, in addition to skin symptoms such as rash and tingling, we recommend providers to ask questions about fatigue and arthritis occurring after extensive sun exposure. Whether noted from patient's history or physician observation, photosensitivity remains one of the 11 diagnosis criteria SLE as determined by 1982 American College of Rheumatology ACR guidelines. Thank you for listening. This is Dylan Monroe, and this is my view on lupus.